Cradle cap. The best treatment options. Cradle cap is the greasy, yellow scaly patches that sometimes appear on the scalps of young babies. It's a common harmless condition that doesn't usually itch or cause discomfort to the baby. If your baby is scratching their head or there is swelling, speak to your GP as it may be a sign of another condition, such as atopic eczema. The medical name for cradle cap is seborrheic dermatitis. It usually occurs on the scalp, but can also appear on the face, ears, neck, nappy area or in skin folds, such as at the back of the knees and armpits. Cradle cap usually appears in babies in the first 2 months and tends to clear up by itself after a few weeks or months. In the most cases, it will clear by the time your baby is 1 year old. Cradle cap look like. Cradle cap is easy to recognize by the large, greasy, yellow or brown scales on your baby's scalp. The scales will start to flake and may make the affected skin look red. Sometimes the hair will come away with the flakes, but it will grow back. Causes cradle cap. It's not clear what causes cradle cap, although it may be linked to overactive sebaceous glands. These are glands in the skin that produce an oily substance called sebum. Some babies are thought to retain some of their mother's hormones in their bodies for several weeks or months after their birth. These hormones may make the baby's glands produce more sebum. Cradle cap isn't contagious and it isn't caused by poor hygiene or an allergy. It doesn't mean the baby isn't being looked after properly or has an infection. Babies with cradle cap may be more likely to develop dandruff, which is another type of seborrheic dermatitis, when they're older. Cradle cap need treatment. Most cases of cradle cap will clear up on their own in time. Gently washing your baby's hair and scalp with baby shampoo can help prevent a buildup of scales. Massaging baby oil or natural oil, such as almond or olive oil, into their scalp at night can help loosen the crust. There is usually no need to see your GP if your baby has cradle cap. However, you may want to ask them for advice if your baby's scalp becomes inflamed or if the cradle cap spreads to other parts of their body. It's important not to pick at the scales as this can cause an infection. Special shampoos. You can buy special shampoo for cradle cap from your local pharmacy. Always read the instruction leaflet to check it's safe to use on your child. Avoid getting the shampoo in your baby's eyes. If you're unsure about using it, speak to a pharmacist for advice. Generally, don't use shampoos that contain groundnut oil or peanut oil on children under 5 years of age. See your GP if your baby's cradle cap is severe, if there is swelling or bleeding, or if there are signs of cradle cap on their face or body. Treating an infection. If your baby's cradle cap becomes inflamed or infected, a course of antibiotics or an antifungal cream or shampoo such as ketoconazole may be prescribed by a doctor. A mild steroid cream such as hydrocortisone may also be recommended for an inflamed rash. Cradle cap is a common harmless skin condition that often affects young babies. Treated. Cradle cap is not harmful to your baby. It usually goes away by a baby's first birthday. Home treatment is usually all that is needed for cradle cap. An hour before shampooing, rub your baby's scalp with baby oil, mineral oil, or petroleum jelly to help lift the crusts and loosen scales. When ready to shampoo, first get the scalp wet, then gently scrub the scalp with a soft bristle brush for a few minutes to remove the scales. You can also try gently removing the scales with a fine tooth comb. Then wash the scalp with baby shampoo, rinse well, and gently towel dry. Call the doctor. If the above measures do not work, talk to your doctor before using a dandruff shampoo. If these products get in your baby's eyes, they can cause irritation. Your doctor may prescribe other medicines. Cradle cap treatments. You may hear or read about remedies involving either shampoos, including anti-dandruff shampoos, and oils. I would avoid some of these things like the plague, as they can be quite irritating and even dangerous for a baby. If you're going to use an oil, you may as well use one that is going to have some added beneficial properties. Below are some suggestions on some gentle treatments for cradle cap. All you need to do is apply the chosen treatment, making sure it's covered well on the scalp, not the hair. Let it sit for a while to soften up the cradle cap. Give it a bit of time to absorb, overnight if you wish. Depending on what you've used, all you then need to do is wash it off with warm water. You can also gently brush off the cradle cap with a fine tooth comb. Coconut oil. My first and best suggestion would be to use coconut oil, which is completely natural, non-toxic, safe for baby, and contains so many wonderful properties not found in other oils, including antifungal and antibacterial actions. If the cradle cap is fungal, then this will certainly help address the root cause and not just treat a symptom. I am a huge fan of pure coconut oil for the body and skin. You can purchase this oil from health food stores or plenty of online stores, ensuring it's not a refined or mixed oil product. For optimal therapeutic results, opt for organic if you can. Note that coconut oil is in a solid form. It can be confusing the first time you realize it's not a liquid like other cooking oils, but it softens easily to apply on baby's head. If you decide to warm it up yourself, please be careful of not getting it too warm on baby's head. Coconut oil also smells so much better than many other oils, especially when it's a warm day when it really brings out oily scents, and it has so many other uses after you treat your baby's cradle cap. For loads of information on coconut oil and its many benefits and uses, including health problems it can help with, check out coconutresearchcenter.org. Olive oil. Olive oil is probably the most common oil used by parents for cradle cap removal. It's cheaper than coconut oil and more readily available, but it doesn't have the many beneficial properties. If you can't access coconut oil, you probably have some olive oil around the home that you can use immediately. Jojoba oil. Jojoba oil is a great oil for skin and has anti-inflammatory and antibiotic properties, but if your baby has sensitive skin, you might want to avoid it as it may irritate a baby's sensitive scalp. Alternately, you can mix it with another oil. Only use a small amount. Sodium bicarbonate, bicarb soda, baking soda. This is another gentle option that some mothers find works well. You can make a paste and apply it to baby's scalp before a bath, then rinse it off afterwards. Alternately, use a solution as a wash, 1 tablespoon of bicarb soda to 1 cup of water. Baby oil, mineral oil. I have included this one in the list as I suggest to all parents to avoid using baby oil, which is mineral oil, altogether. It is a very inexpensive product to make and doesn't spoil easily, which is why it is used by manufacturers. It is difficult to absorb and clogs pores, slowing the skin's ability to eliminate toxins. Baby oil is made from a petrochemical byproduct and you don't want that on your baby's skin at all. In fact, it can make babies very sick and have fatal consequences if your baby inhales this oil into their lungs. It can stop them from working. There have been cases where toddlers and young children have gotten into baby oil and ended up with serious respiratory conditions. Click this link to see a story which was featured in the news. There have also sadly been some fatalities. When ingested, it's been linked to a multitude of serious health problems. Baby oil is like leather on skin, so you can imagine what it can do to little lungs. Ditch baby oil and choose something healthy, gentle and safe for baby.